Syphilis is a sexually transmitted infection (STI) caused by the bacterium Treponema pallidum. It has been known for centuries and can have serious long-term health effects if not treated properly. The disease progresses through several distinct stages, each with its own symptoms and complications. Stages of syphilis. Primary syphilis. Symptoms. The first sign is typically a single, painless sore called a chancre, which appears at the site where the bacterium entered the body, usually on the genitals, anus, or mouth. Duration. The chancre usually develops about 3 weeks after exposure and heals on its own within 3 to 6 weeks, even without treatment. However, the infection remains in the body. Secondary syphilis. Symptoms. This stage may present with skin rashes, often on the palms of the hands and soles of the feet, mucous membrane lesions, fever, swollen lymph nodes, sore throat, and muscle aches. Duration. These symptoms typically appear a few weeks to months after the chancre heals and may last for several weeks before resolving. Contagiousness. This stage is highly infectious. Latent syphilis. Symptoms. During this period, there are no visible symptoms. The infection remains in the body, and serological tests, blood tests, can detect it. Duration. The latent stage can last for years, and without treatment, the infection can progress to the tertiary stage in about 15 to 30% of cases. Tertiary syphilis. Symptoms. This stage can occur many years after the initial infection and can affect multiple organ systems. It may cause severe complications, including cardiovascular problems such as aortitis, neurological issues, neurosyphilis, and gummatous lesions, soft, tumor-like growths in various tissues and organs. Severity. Tertiary syphilis is serious and can be life-threatening if not properly treated. Neurosyphilis. Neurosyphilis occurs when the infection spreads to the central nervous system. It can happen at any stage and may cause symptoms such as headaches, altered behavior, difficulty coordinating muscle movements, paralysis, sensory deficits, and dementia. Diagnosis. Blood tests. The most common diagnostic tools are blood tests, including non-treponemal tests, for example, VDRL, RPR, and treponemal tests, for example, FTA, ABS, TPPA. These tests help confirm the presence of the bacterium. Physical examination. A healthcare provider will examine any sores, rashes, or other signs of syphilis. Lumbar puncture. If neurosyphilis is suspected, a spinal tap may be performed to analyze cerebrospinal fluid. Treatment. Antibiotics. Penicillin is the most effective treatment for syphilis at all stages. The dosage and duration of treatment depend on the stage of the disease. Alternative treatments. For individuals allergic to penicillin, other antibiotics such as doxycycline or zithromycin may be used, though penicillin remains the preferred treatment. Follow-up. Regular follow-up blood tests are important to ensure that the infection has been fully eradicated and to monitor for any potential complications. Prevention. Safe sexual practices. Using condoms consistently and correctly can significantly reduce the risk of transmission. Regular testing. Regular STI screenings are crucial, especially for individuals with multiple sexual partners. Informing partners. It is important for anyone diagnosed with syphilis to notify recent sexual partners so that they can be tested and treated if necessary. Public health measures. Public awareness campaigns and education about safe sexual practices can help reduce the spread of syphilis. Complications. If syphilis is not treated, it can lead to severe complications, including cardiovascular problems, such as aortitis or aneurysms, neurological disorders, including meningitis, stroke, and dementia, organ damage. Long-term untreated syphilis can damage multiple organ systems, leading to chronic illness or death. Congenital syphilis. If a pregnant woman has syphilis, the infection can be passed to her baby, leading to serious complications or stillbirth. Conclusion. Syphilis is a complex infection with a long history and a wide range of manifestations. Early diagnosis and treatment are essential to prevent long-term health problems and complications. Through safe sexual practices, regular testing, and prompt treatment, the spread and impact of syphilis can be significantly reduced.